In this video, we will be looking about methanol poisoning in forensic medicine in detail. Okay. So before seeing methanol poisoning, let's understand what is drunkenness. Definition: an individual is certified to be drunk when he is under the influence of alcohol, so that he lost his faculties to such an extent to make him unable to execute safely the occupation in which he is engaged at that material time. So basically what they are trying to say is the individual is under the influence of alcohol and he cannot perform his activities properly, which is in his occupation. Okay. Stages of alcohol intoxication. There are 3 stages of alcohol intoxication. First one is stage of excitement, where the blood alcohol level is around 50 to 150 milligram per 100 ml, and there is a sense of euphoria in a non-addict person. This is due to inhibition of higher inhibitory centers of brain, resulting in excitation, increased self-confidence and lack of self-control. There may be disclosed secrets. The person may disclose impairment of cognition, sensory perception, judgment, slurring of speech, drowsiness, impaired memory, visual acuity is impaired. Desire for sex is increased but performance is impaired. Stage of incoordination. Blood alcohol level is around 150 to 250 milligram per 100 ml. First one is stage of excitement, okay? And now we have a stage of incoordination. The person may become the person becomes cheerful, excitable, quarrelsome, or irritable due to further depression of higher centers. Okay. Face is flushed, that is the face is drained by blood vessels more frequently. Rapid pulse. Face is flushed. Rapid pulse can be correlated with one and each other. Pupils are dilated. I think the sympathetic system is activated a little bit, I guess. There is sluggish reaction to light. Alcohol gaze nystagmus. And temperature becomes abnormal. Incoordination of fine and skilled movements. Okay. Stage of coma, where the blood alcohol level is more than 350 milligram per 100 ml. Thick and slurred speech, marked incoordination. The person feels giddy and staggering gait and he may fall. Okay. Now coming to in the stage of coma, pupils are constricted, but if the person is stimulated, pinching the skin or slapping gently, pupils dilate for a while and slowly constricts. This is called McEwen's sign. Okay, what is McEwen's sign? When a person who's in the stage of coma due to alcohol can be stimulated by pinching the skin or slapping gently, such that his pupil dilates for a while. Okay, the person may become comatose. Comatose is a stage of coma. It's just again explaining the same thing. Treatment: maintain airway, breathing and circulation. Gastric lavage with the alkaline solution within 2 hours of ingestion. IV fluid: 1 liter of normal saline plus 10% of glucose plus 10 milligram of thiamine plus 15 units of insulin. So we have to remember this. So gastric lavage is given with alkaline solution within 2 hours of ingestion. And what happens is that 1 liter of normal saline plus 10% of glucose. 1 liter of normal saline, 10% glucose, 100 milligram thiamine and 15 units of insulin. 100 milligram thiamine, 15 units of insulin, 10% of glucose, 1 liter of normal saline, 10% of glucose, 100 milligram of thiamine and 15 units of insulin. Examination of a person of for drunkenness certificate. Preliminaries: name, age, sex, address, occupation has to be noted. Time and place of examination, two identification marks, informed consent, name and number of the accompanying constable. History: has he consumed alcohol? If yes, nature and quantity, whether he is suffering from any disease or disability, whether he is taking any drugs or medication, whether he is a diabetic or insulin patient. General physical examination: BP, pulse, temperature. General behavior: calm, talkative, or abusive. Stage of stress. It's just this is just stage of consciousness. Okay. Speech: normal or slurred or over precise. And memory: check for awareness of recent events. Orientation: check for orientation to time, place, and person. Handwriting: check of omission of letters and words, etc. Mouth, breathe smells of alcohol. Skin dry, most flush in pale. Eyes swollen or normal. Conjunctiva congested or not. Pupils dilated or constricted. Dilated or constricted, both can happen. Dilated in stage of incoordination and excitement. Constricted in stage of coma. Okay. Nystagmus may be present or not. Light reflex normal or sluggish. Visual acuity normal or diminished. Gait: manner of walking can be straight or irregular. Reaction time to a direction to turn is normal or long. Manner of turning balanced, tendency to fall. Okay. Reflexes: normal or sluggish. Coordination: finger nose test. Finger nose finger test. These are the tests has to be performed to check the coordination. Okay. Buttoning and unbuttoning shirt. Picking a pencil and a pen from floor. Walking in a straight line. So coming to methanol poisoning, this is the main topic here right now. Methanol is a common ingredient in antifreeze, paints, and solvents. Antifreeze, paints, solvents, the common ingredient. Okay. It is also used in photocopying fluids, shellacs, and windshield for washing fluids. Poisoning usually follows ingestion of contaminated alcohol beverages or methylated spirits. Ingestion of contaminated alcohol beverages and methylated spirits. Mechanism of action: methanol is oxidized in the liver to formaldehyde by alcohol dehydrogenase. Formaldehyde is converted into formic acid by aldehyde dehydrogenase. Formaldehyde is converted to formic acid by aldehyde dehydrogenase. Formic acid causes retinal toxicity and metabolic acidosis. Okay. So this is the flow chart. That is methanol in presence of alcohol dehydrogenase gets converted to formaldehyde. In presence of aldehyde dehydrogenase, it gets converted to formic acid. In presence of tetrahydrofolate something, I guess, it gets converted into CO2 and H2O. Ethanol and fomepizole are the antidotes for methanol poisoning. Clinical feature: general nausea, vomiting, headache, dizziness, vertigo. GIT, abdominal cramps, and pancreatitis. CVS, tachycardia, hypotension, and hypothermia. RS, dyspnea, cyanosis, breath smelling of alcohol. CNS, delirium, convulsions, and coma. Drunkenness is not as marked as seen in ethanol. So yes, kidney acute tubular necrosis, high anion gap, so metabolic acidosis. Eye is most characteristic feature. Where it causes optic nerve, optic atrophy, dilated fixed or fixed pupil, photophobia, blurred vision, flashes of light, snowstorm or snow-filled vision as if seeing through a snowstorm. Okay, that's what it shows: snow field vision or snowstorm kind of vision. Central or peripheral scotoma and constricted visual fields, decreased light perception, and sudden loss of vision due to optic neuritis, optic atrophy, cause of death, acidosis, and respiratory failure. Now, coming to the treatment part, gastric lavage with sodium bicarbonate solution. MSS can be tried within 2 hours of consumption. Folinic acid or folic acid can be given. Ethanol is the specific antidote. Ethanol competes for the enzyme alcohol dehydrogenase, thus prevents metabolism of methanol, which is excreted unchanged in urine. Methylpyrazole or fomepizole, competitive antagonist of alcohol dehydrogenase, is a newer antidote. Hemodialysis to be done in severe poisoning. Now, the postmortem appearances. Cyanosis, especially in the upper parts of the body, stomach and duodenum, mucosa congested with hemorrhagic spots, pancreas, hemorrhagic pancreatitis, lungs, congestion, edema, desquamation of alveolar epithelium, liver fatty changes, kidney tubular degeneration, eyes retinal and optic atrophy, CNS, cerebral edema, even necrosis in the basal ganglia. Viscera for chemical analysis should be preserved in saturated saline solution. Thank you. Bye.